Hello everyone, this is Dr. Prashant Reddy, consultant physician from Renova Hospitals, Bajarahills. Today we will speak about dengue fever and why is it important and what can be done to prevent it and what is the treatment for the dengue fever. So dengue fever, we generally see it more in the monsoon seasons because of the high prevalence rate of the mosquitoes. So dengue fever is generally transmitted through a mosquito bite. When a mosquito bites a patient or a person with a dengue fever and bites another person, we generally see the dengue fever or the dengue disease being transmitted from the one person to other person. So what are the symptoms that we see in a dengue fever? So in dengue fever, the first and foremost symptom is fever. The patient or the person presents with high grade fever, severe body pains and joint pains and severe headache and dehydration. So there is a possibility of people presenting with bleeding also in the dengue fever. So what are the situation or conditions where the patient should immediately reach out to a hospital or a doctor? Whenever patient has the above mentioned symptoms, he should meet the nearest physician or the nearest doctor as early as possible. Once they meet the doctor will do the required investigations and go ahead with whether the disease is dengue or any other disease. Once it's been confirmed it's a dengue fever, the doctor will prescribe the required medications. Who should be admitted in the hospital and who should be treated at home? This is the common most question or everyone has a doubt about. So the people who are having or the patients who are having platelets of less than 1 lakh on investigations, or the platelets are going down daily and reaching a point where it's going less than 1 lakh, are advised for admission. Or the patients who have bleeding from their nose, that is a blood loss from their nose or their gums, or whenever they cough, or blood is seen in their urine, or anyone who are having black colored stools, that is a motion coming out in a black color, are advised for a hospital admission. So these indicate that there is some bleeding going on because of the low platelets and high dengue virus in the body. So how do you treat this dengue fever? Dengue fever, the first and foremost treatment is fluids. So patients are advised to take at least a minimum of 3 to 4 liters of fluids in a day, and good proper sleep, that is good rest, about 7 to 8 hours of sleep, and very good protein diet and a carbohydrates diet. The patients who are admitted in the hospital are given IV fluids, and if required, platelets are being given from the outside. And how can this be prevented? This can be prevented by making sure that there are no puddles of water nearby, using mosquito repellents, mosquito nets, and using the ointments which can reduce the mosquito bites. For any other queries, please contact Renova Hospitals, Bajarahills.